even in countries that are producing increasing amounts of food, we are seeing that there are still high levels of childhood malnutrition, particularly between the period of conception and the second year of life. And we know that malnutrition at that time has a long-term adverse effect on the prospects of an individual for schooling and for employment. And it's over the last 2 or 3 years that scientists have shown that there's a relatively small number of interventions that matter, that will lead to improved nutrition. Ensuring the right diets, breastfeeding when children are very young, proper care of women when they're pregnant so that the fetus grows adequately and so there are minimal problems during delivery. Proper hygiene and water and sanitation to reduce the risk of disease. And then the continuous availability of the foods that a child needs to grow a good brain, to grow a good body, particularly in the early years of life. We know that these interventions are key. We know that they're relatively inexpensive to make available. We know that in terms of cost effectiveness, they represent a very, very valuable investment in children, possibly one of the most valuable investments that exist. So one of the keys to enabling children to enjoy better nutrition, pregnant women to have more nutrients during their pregnancy, is to ensure that the food they eat contains the right mix of energy, protein, micronutrients in a way that their body can actually use to enable them to be healthy. Now, this depends on a number of factors. Firstly, have they actually got these foods in their home diet? There are many parts of the world where during certain months of the year you just can't get vegetables that contain vitamins, or you can't get the foods that contain the necessary minerals or elements that are essential for good growth, zinc or iodine or other such vital requirements. There are times of the year when people just don't get the iron they need to ensure good nutrition, especially during pregnancy, and so as a result they get anemic. To enable people to access these kinds of diets that contain the necessary balance of energy and nutrients, we have to concentrate on the right kinds of farming practices, the right kinds of marketing practices that enable people to grow and then access and then consume the food they need. What we're trying to do is to get nutrition as a much more central part of human endeavour, of development activity. And rather than do it through saying, this organisation is in charge or that organisation controls, we're saying let's create it more as a movement where different groups can each contribute to a result. Now it sounds quite basic, but in fact it's a quite complicated process because it's bringing together people working on agriculture, people working on social welfare and safety nets, and people working on health and disease issues. But by getting these joint task forces at country level working on the issues together, we're better able to understand how to protect and improve nutrition whilst at the same time enabling better food security.